These are the interviews from Chat City on Preston FM. Don't forget, our show is live weekdays from 10 till noon. Tune in and become part of our family.
Lovely to be with you, and thank you for choosing Preston FM. And right now, my guests in the studio, looking a little wet this morning, I must say, so I do thank them for braving the rain out there. It's lovely to welcome into the studio Veda West and Graeme Tobyn with our natural health feature. So a very good morning to you both.
Good morning.
And the microphone is all yours, as they say.
Okay, thank you, Hugh. So Veda and I are colleagues, medical herbalists who run the Preston Herbal Clinic at the Remedies Centre for Health, Ashton, Preston. Now, today my talk is on constipation.
I was actually laughing about this with a patient of mine in clinic the other day, how constipation is a favourite subject for herbalists and bowel movements, and I see you're no exception, Graeme.
Yes, well, doctors each year write millions of prescriptions for laxatives, so it must be a significant issue. Anyway, Veda, the first thing is to clarify what is meant by constipation, which is any combination of the following: infrequent bowel movements, a decrease in the volume or weight of stool, the need to strain to have a movement, a sense of incomplete evacuation, and the need for enemas, suppositories or laxatives to maintain regularity. Now, straining is never a good habit to get into, since the resulting rise in what's called intracolonic pressure can lead to the creation of bulges in the gut wall, a condition known as diverticulosis. It may also bring on piles or hemorrhoids. A sense of incomplete evacuation is often experienced by sufferers of irritable bowel disease and is thought to be due to the rectum not fully emptying as a result of disturbed functioning of the gut. And the inability to do a poo without laxatives is often through the overuse of laxatives in the first place, a condition known as atonic bowel.
So Graeme, if constipation can be infrequent bowel movements, how frequent should they be?
Well, that's the $64,000 question.
Sorry, Graeme.
Well, advice is that it could be anywhere between 3 times a day, meaning after every meal, in fact, and 3 times a week. I think, though, that herbalists such as ourselves, Veda, always like to hear that at least one bowel motion a day is taking place.
Yes. And what about volume or weight of the stool?
Well, this must surely depend to a great extent, on what you've eaten. I'll always admire Dr. Gillian Keith, whatever may be thought about the origin of her title, for showing poo on TV. One of her subjects was a very large man whom she berated for producing such small stools, and she linked this directly to his diet.
So what causes constipation?
Well, we've named 2 situations already, Veda. That's laxative abuse and IBS. Not enough fibre or liquids in the diet, and certain drugs, for instance codeine-based painkillers and iron supplements are the well-known ones, are the other 2 common causes. There is also a chicken and egg relationship between constipation and hemorrhoids or piles. If constipation has provoked piles, painful piles may discourage you from passing a motion, and not answering a call of nature is never a good habit. So the piles need soothing and reducing, and then the constipation treated.
What would you do for piles?
Well, as you know, Veda, we have astringent herbal ointment such as witch hazel or the stronger oak bark to apply. And these should be combined with an internal mixture containing anti-inflammatory chamomile, relaxant fennel, a bitter herb, for instance calamus root, and a laxative such as alder buckthorn for limited period of treatment to get the piles reduced. In the end, patients need to obtain a treatment either from a pharmacist or a herbalist to use for a number of days. And then, if the situation is still not remedied, the patient must see their doctor for a rectal examination, because the passage of blood from the rear end, as seen on the toilet paper in cases of piles, should not be taken lightly. At the risk of lowering the tone of this conversation even further, a phrase I have heard used by medics concerning the diagnosis of blood per rectum is, if you don't put your finger in it, you might put your foot in it.
I mean, this is something, like rectal examinations isn't something that herbalists tend to do, is it, Graeme?
No, it's not.
So what would you recommend for sort of treatment of constipation?
Well, first of all, sufferers need to make sure that they're drinking enough fluids each day. So that's non-caffeine, non-alcoholic fluids. So water is good. And we'll probably need to increase their intake of roughage from fruit and vegetables and whole grains, such as wholemeal bread and brown rice. These help to bulk up the stool so that the gut can pass it successfully. 2 drugs, lactulose and Movicol, work by increasing the fluid absorbed into the digestive passage. But there is no way around getting adequate hydration in the first place. Increasing fibre in the diet should not be done suddenly, but built up gradually. I remember treating 2 children from the same family for chronic constipation, the younger girl a year after her elder sister. The older one was taking very strong laxatives from their doctor, but nevertheless had to go into hospital every couple of weeks to have a manual evacuation of her bowel because she could not pass any motions. I quickly resolved the matter by prescribing a diet extremely low in roughage, together with quantities of crushed linseeds. Once more regular bowel motions were established and the girl had the confidence to be able to pass a motion without age, I gradually increased the roughage in her diet and her problem was solved. The moral here, I thought, was not to knock on the door too hard. As to herbal remedies, the gentlest, as you know, Veda, are the simple bitters. Dandelion root coffee or chicory coffee are available at health food shops and supermarkets. Stimulant laxatives like senna are only to be used short term, no more than 2 to 3 weeks, for a sudden acute problem. What can be taken longer term are what are called the bulk laxatives, like isfagula seed or husks, which doctors also prescribe, or crushed linseed. When taken with plenty of water, these seeds bulk up in the gut and add size to the stool for easier passage. So that's all I'm going to say about constipation.
Okay.
What are you going to talk about today, Veda?
Well, I'm going to talk about herbal medicine in the kitchen. So when asked to think about herbal medicine, you may think of seeing your local practitioner or herbal products that you buy in health food shops or even supermarkets. However, within your own kitchens, there's an abundance of medicinal foods, herbs and spices that can be used to improve health and help with minor conditions. So I'm really just going to touch on a few because there's so many, which is quite exciting topic, I think.
Yes.
So one of the most obvious examples is garlic. Now, garlic thins the blood. It's anticoagulant and has been found to lower blood cholesterol and blood pressure. In its raw state, it's also antimicrobial and is great for simple respiratory tract infections. So it can be of benefit for things like coughs, colds and sinusitis. To get the most out of garlic, you need to crush it, then chop it. To make it more palatable, you can use it on toast, either with a bit of olive oil, butter or honey. So it's a bit easier to take.
Yes, now not everyone likes garlic. I mean, would you recommend onions in the same?
Onions work very similarly to garlic, so that's a good alternative, yeah. Yes, Graeme, yeah, definitely.
So what else is there, Veda?
Well, one thing you'll hopefully have in your cupboards are oats. And oats are great for the nervous system. Indeed, they are said to feed the nervous system, especially when under stress. They are particularly helpful for nerve stability and exhaustion, which can also occur after illness. So, often in times of stress, you may not be eating properly, and things like getting oats into your diet is fantastic, full of B vitamins and just helps to give you the energy to tackle the day.
Yes, porridge is a good way to start the day.
It is, it's excellent. They also help to lower cholesterol levels, so they're a wonderful addition to the diet. Externally, oats can be a benefit for eczema, in that they help to ease the irritation and itching if that's a problem. And all you need to do is simply place a couple of handfuls in a cotton bag or nylon stocking, tie up so you don't end up bathing in porridge, and add to the bath. And if you want to, you could add a bit of lavender essential oil, or if you do have any herbs like chamomile or marigold or rose, or even peppermint would take away itching, you can add those as well.
And you can use that bag of oats to sort of actually rub the skin, can't you?
You can.
Where the itching's happening.
Yeah, you can. And if you squeeze it, it'll give off like a milky substance, which is really soothing, really nice. You can buy oat tincture, which is an alcoholic preparation of oats. And in my opinion, the best way to take oats is to incorporate them into your diet. So eating porridge is an excellent start to the day. And you can add a good pinch of cinnamon for taste and as a warming digestive.
Now, that's another thing I've got in my kitchen, cinnamon.
Yes, it's fantastic. And it's really good because it's warming as well. So you've got, it's going to be good for things like colds and for poor circulation. And it's also good for the digestive system, for indigestion and weak digestion.
Now, I remember a story, Veda, about cinnamon. After the First World War, there was the Spanish flu epidemic, and more people died in that than they did in the war, amazingly enough. But I heard a story about a factory in the north of England that, powdered cinnamon to put into jars for sale, and none of the workers in that factory came down with Spanish flu.
Oh, well, that says a lot, doesn't it? I didn't realise that. That's interesting.
Yeah.
So likewise, ginger is warming and good for the digestive system, and it's particularly good for nausea, so you can take it for things like travel sickness. It improves the circulation, particularly to the hands and feet, and makes a good cold remedy. Ginger is diaphoretic, meaning it promotes sweating, so it's great for colds and flu. I'm sure many of you will have tried lemon and ginger tea when suffering from a cold, and there's obviously things like lemon and honey which are going to help, and so you can make quite simple, good cold and flu remedies from things you can find in the kitchen. Another spice you may find in your cupboard is turmeric. And it's probably best known for its ingredients in curries and gives the intense yellow colour that if you're unfortunate to get on your clothing, it's a real pain to remove. It's a great anti-inflammatory and therefore can be really helpful for things like arthritic conditions. It also thins the blood, meaning that you should avoid large amounts if on blood thinning medication, things like warfarin and so forth. It's best taken with yogurt or milk as the fats of aids absorption. And to further increase absorption, I'd recommend taking it alongside black pepper. And turmeric and black pepper with hummus makes a lovely dip. So these things, if you can, try and make them enjoyable. Get them into your everyday diet. And black pepper's great for indigestion and flatulence. It's quite a warming digestive herb, isn't it?
Yes. I mean, one of our traditional warming herbs is mustard, isn't it?
Yes, mustard.
And I have that in my kitchen. I mean, probably the way I use that, Veda, is in making a salad dressing. And there's an opportunity as well to use another old English standby, which is apple cider vinegar.
Yes.
So olive oil, apple cider vinegar, some mustard powdered or grain, and some honey, salt and pepper, and mixed up together, that makes a wonderful salad dressing.
And a healthy one. If you have a garden or a yard, you may fancy growing some herbs to use in cooking. So you've got things like sage, thyme, rosemary and mint. But these are also medicinal. And I do believe that you should try and get some of these things into your diet. It's just for your general health.
Absolutely.
And if you need to, things like thyme's fantastic antimicrobial and it's antifungal. Sage can be used for things like hot flushes. So obviously you've got to be careful about using it long term. So for short term only. Mint's great for digestion, and it's really good in things like colds and flu. And rosemary is really good for digestion and circulation. So there's lots and lots of good things you can do. Yeah. As always, it's always worth remembering if you're pregnant or on any medication, it's best to consult a qualified medical herbalist. That's it.
That was a very interesting tour around your kitchen.
Thank you.
Thank you.
That's right. Yes, very interesting. And thank you both for coming in this morning.
Thank you.
And see you in a few weeks' time when hopefully it might be a summer's day.
I hope so.
That's right. And I must admit, just on the garlic, I love garlic. I love raw garlic.
Oh, good.
But unfortunately, I've lost lots of friends because of the amount of raw garlic I eat. But I do love garlic. But lovely to see you both, and thank you both for coming in this morning.
Thank you.
So there you are. That was Veda West and Graeme Tobyn, and you're with Chat City, Preston FM 103.2.
Thanks for listening. We hope you've enjoyed the interviews as much as we have. Why not give us a tweet at Chat City BFM?